Very much. Thank you, Dr. Ozan, for your excellent presentation. Really insightful, and we all need to know those things. It's very important to understand how the bone grafts are working. So let me share my screen. Okay. Can you see it?
Yes, we can see it, Doctor.
Okay, lovely.
That's perfect.
Okay. So in the next 60 minutes, I'm going to talk about my clinical cases, my experience, my understanding why I'm using these synthetic materials in everyday practice. And what we are going to try to do is we will show you cases in order for everyone, for all of you, for your cases that you have every day in your clinics, to know all the steps from the beginning to the final result. So to have knowledge, to have confidence, and also to have understanding the materials, which tools, which techniques to use in a consistent way, so to get successful and predictable results. We're going to see many cases, synthetic materials, and tools and techniques that the aim is to improve our work, and at the same time also to have less steps and to simplify what we are doing, because this is also very important and for us and for our patients. So it's very important to have to establish and to apply solid, well-defined protocols in our everyday work. So that's what we are going to discuss. This is me. I did all my studies, my PhD, my Master of Sciences in oral surgery back at my home in Athens, Greece. Also, I'm a fellow and a diplomate of ICOI. A big part of my job is to do research, lectures, webinars, publications. And the last 10 years, I work in central London in the UK. We have done many publications. The last 20 years, we have published more than 30 papers. All of them are indexed in PubMed. You can search and find and read everything. And our research is focused mainly on bone grafting. So we have done lots of preclinical and clinical studies to understand and to evaluate and to improve how the synthetic bone grafting materials are working. So as I told you, we need every day we need protocols, and these protocols, what they need to be? They need to be clear, logical, predictable, simple. We need to simplify our work so we can have more time and less expenses. That's what we are going to show to you, this kind of protocols. And to apply the protocols, to understand what we are doing, the first thing we need to know is that dental implants are a unique but a complex biological system. And this system comprises of hard tissues, as we can see, mechanical components, soft tissues, and oral bacteria. So it's not just an implant, it is a mechanical implant, a titanium implant. We have hard tissues all around the fixture, and then we have other mechanical components like the provisional or the final abutments, the zirconia, the porcelain, the prosthetic screws. So we can see clearly it's hard tissues, it's mechanical components, it's soft tissues, also very important, not just for aesthetics, but we need healthy, solid soft tissues around the implant prosthesis, because these soft tissues will create the soft tissue barrier, the soft tissue seal, and the soft tissue seal will protect the underlying hard tissues and the implant from bacteria and infections. And last but not least, and very important, is that all the mechanical components, all the soft tissues are surrounded by oral bacteria, by the flora, the biofilms, and we need to be aware of this, and we need to control the bacteria in all the phases of the treatment and in the long term, because if we don't control the bacteria, we get infections, we get inflammation, and in the long term, we can get peri-implantitis and big problems. So we need to think about a system. We need to think about all the components. And in simple words, when we are talking about systems, we are meaning a set of components, and these components are interconnected and interdependent. Every system is like that. And in our work, our favorite system is the implant system, which is an anatomical and a functional biological system. So, how we can become good implantologists, good surgeons, how we can have good results. It's not a secret. Everything now is simple. We have the knowledge, we can read and we can understand and we can apply everything. And no one became ever a good implantologist by luck. Everyone who has good results, everyone who has consistently good results, just applies those things and knows exactly these pillars of implantology. So in order to understand and have good results, this is what we need to know about implants. First of all, we need an excellent planning for the 3D implant positioning. We need to know and select the correct implants and abutments. Very important, and mostly this is what we discussed today, the quality and the quantity of hard tissues and how we can work with it. The soft tissues, very important, the anatomy and the thickness of the emergence and the cervical profiles of the soft tissues, the materials we are using, and again, never forget to control and take care of the biofilms. Okay, this is all very important. I will give you a very simple example, because if any of these steps has a problem, as a domino, because the elements are interconnected, we will have problems with all the other elements of our implant. So if we start from the 3D implant positioning, you can see that if we don't place the implant at the correct position, then we have just problems. All the next steps will be difficult. And even if we manage to restore this implant, you see immediately that we don't have good soft tissues. We don't need to raise the flap to know that there is no bone buccally. It's a food trap. We will have lots of bacteria accumulated here. We will not be able to have a good anatomy of soft tissues. We will have mechanical problems. So you see how all the elements are connected, and just the simple first element, if it goes wrong, then everything as a domino goes wrong. So when we do our planning, in every case, we need a good planning. We need to think for each individual case and in each individual patient, all these simple but very important elements, because they are connected, and if something goes wrong, then everything goes wrong. This is the implant system, and briefly to tell you that we must never forget that the implant system is a part of bigger systems, and also each system is connected to each other. So the implant system is a smaller part of the stomatognathic system. And why this is important? This is very important because, let's say, if the patient is a bruxist, if the patient grinds the teeth, then we can have problems and mechanical failures with our implant. Or if we have periodontitis, we don't control the bacteria around the natural teeth in the stomatognathic system, then also we'll have peri-implantitis. And these systems are also part of the bigger system of the body. And let's say if we don't have enough vitamins, or if we have osteoporosis, then we'll have problems with our oral system, and then we'll have problems with our implant. So everything has to do with systems. We need to know this, and we need to understand how all this works, so we can have good results, and also we can understand and explain when we have problems and failures. So we're talking about systems, and another example. This is a very important article published by the team of Joseph Sucrun. So they show and they explain in detail how a lack of vitamin D can slow implant osseointegration and also can give us lots of failures with our bone grafting, because everything is connected and everything affects what we are doing. So we need to be very careful. I give you a nice example here. We need to measure the vitamin D levels of our patients before we do any bone grafting and before we do any implant surgery. We can do this in the clinic. I use this very simple system. We just take a drop of blood, and when we do the consultation before we do our surgeries, we know exactly the vitamin D levels of our patients before we proceed, and if they are low, we give supplements. Because we need to start from the basics. So like a vitamin deficiency is very important. A bad immune system is very important. And also we need to start from the extractions, from our basic surgery, because we need to have good extractions in order to not to damage the soft tissues, to preserve the bone that we have naturally, and to do the first step, which is the extraction, nicely and quickly, and in this way to gain the confidence from our patient. It might sound basic, but it is surprising how many clinicians, they really fail to do good extractions. I mentor many clinicians. We are doing many surgeries, and I see that sometimes they fail to do a good extractions. We have roots left behind. We need to understand how to remove a difficult tooth, how to section the roots if it's a lower molar, or if we have an upper molar, we need to, like the Mercedes symbol, we need to section all the roots, remove each root separately, and after that, we must never forget to clean everything. It's crucial, it's very essential to clean the sockets, to remove all the inflammatory tissue, to rinse the sides, to disinfect the area, because the big problem is that if we don't do that, if we leave behind inflammatory tissue and then we place a bone graft in there, what is going to happen is that the bone graft will fail because we didn't clean the socket. So it's not a problem of the bone graft we used, it's a problem of our surgical technique. So look at this socket here after removing the tooth. It might look clean, but when we use our gauzes, our suction, our good magnification and good light, and we explore the area, you can see that under this septal bone, we have a big cyst, lots of soft tissues, and this is how it is clean. We need to clean all the bone, because if we just go in there and place our bone graft, the bone graft will fail because this soft tissue will proliferate inside the bone graft. So it's crucial to mechanically clean all the bone before we do our bone grafting. We can use our hands instruments. We can use very sharp hand Lucas curettes. But also what I'm using degranulation burrs. These are specific burrs that they have a specific diamond coating, and we can use them to go deep into the bone defects and clean thoroughly all the soft tissue, remove all the soft tissue and polish the bone so the bone is completely clean. When we do this, it's also important to disinfect the area. I will keep talking about controlling the bacteria in each step because it's a big factor that can give us problems with bone grafting if we don't remove the pathogenic bacteria. So we need to rinse the area, we need to rinse the bone, and we can use disinfectant agents. I'm using agents that they release oxygen, like liquids, solutions, or gels. I apply for a few minutes in my surgical areas, disinfectant gels, agents that they release oxygen, and in this way, they control the bacteria. So we have to keep all this in mind before we plan to do any bone grafting procedures, because it's very, very important, and we need to understand all those things that if we don't take care of them, then we'll have problems with our grafting. So let's see a few everyday cases. like this first molar, the patient developed a fracture. And because it stayed like that for a long time, we have all this big infection, we have a big cyst, we have inflammation, we have a swelling here, a fistula, and we need to start by removing the tooth. It was a difficult extraction, so you can see that although I try to be very careful, sometimes we damage a bit the soft tissues. And what is important to notice here is that it is just a big hole. After cleaning and removing all the soft tissues, after I removed the cyst, we can see that there is no septal bone at all, and also a big part of the buccal plate is also missing. What we know very well is that we need to graft it, because if we will not graft the area, the whole site will collapse. We have done many studies like this animal study. There are